Hi friends, today we'll discuss one more important topic, that is the anatomy of the pancreas. This is Dr. Yusuf signing from University. So these are the two specific objectives which we'll try to cover in this lecture. The first one is describe the pancreas regarding its gross structure, peritoneal relations, blood supply and lymphatic drainage. And the second is describe the main and accessory ducts of pancreas and mention their commencement as well as final drainage. So these are the two specific objectives which we'll try to cover in this lecture. To begin with, a brief introduction about the pancreas. The name pancreas has been derived actually it is a misnomer because it was thought that pan means all and krias means flesh. So they thought that this is completely made up of flesh, that is the muscle. But now we come to know that it is not flesh, it is not the muscle, but it is made up of a gland, actually glandular structure. So but it doesn't have any bone. So previously they thought this is a piece of flesh without any bone, so that's why they called it as pancreas, all flesh. Okay, so it's a misnomer. uh, just a brief introduction. As I said, it is as you know, it's a glandular structure which is soft as well as it is lobulated, and it is a gland which is a mixed gland which consists of both as a exocrine part as well as an endocrine part. Endocrine part mainly it is present in the tail of the pancreas, which are the islets of the Langerhans. It is said to be the largest digestive gland. Among the digestive gland, this is said to be the largest gland. But the largest gland in general will be the liver. Okay. The situation of this gland, if you see the gland, it is almost horizontally placed. Later we'll show you the picture. So it is totally transversely placed. So here you can see this is the pancreas. So this is the whole of the pancreas, this is the head, this is the uncinate process, neck, most of the part is the body here, and the tail of the pancreas is here. So this is almost horizontally or transversely placed, and it is in the posterior abdominal wall. So it is near the posterior abdominal wall and it is behind the peritoneum. That's why it is retroperitoneal. So this is how it looks like when you take a when you have a side view of this gland. So it is present behind the transverse mesocolon, behind the lesser sac as well as the greater sac. And the position of this gland is almost at the level of L1 and L2 vertebrae. So always whenever you talk about some fixed structures, always you correlate with the vertebra, especially whenever it is in the thorax under region, and because this is in the abdomen, so it is in relation to the L1 and L2 vertebrae, and it is behind the stomach. If you can see here, this is the stomach, this is the cross section of the stomach, and here you can see the lesser omentum and this is the greater omentum, and here is the lesser sac, and just behind that will be the pancreas. So it is behind the stomach as well as behind the lesser sac, cavity of the lesser sac. So the stomach and the pancreas are separated by the cavity of the lesser sac. And if you trace it from front, as you know, the abdomen is divided into 9 quadrants, and this will occupy especially the epigastrium as well as the left hypochondrium. It goes beyond to the left hypochondrium. As you can see in this picture, it is going much more on the left side, so it occupies almost the left hypochondrium. As I said, it is transversely placed and it is not exactly horizontal, slightly oblique, with the tail going much more higher compared to the head and neck part. So it is slightly oblique also. If you see the shape, it looks it resembles very much like a retort shape, or it looks like a flask, or it looks like a walking stick, or it looks like a hook, whatever. Because if you can see here, this looks like the stick, walking stick or hook, or retort shape, all of those. Okay, the size of this gland is almost the length is almost 12 to 15 centimeters from the head up to the tail. So this will be the total length, almost 12 to 15 centimeters in length, and the breadth is almost one third of it, almost 3 to 4 centimeters in breadth, and the thickness is almost 1.5 to 2 centimeters. So the length is almost 15 to 12 to 15 centimeters, breadth is almost 3 to 4 centimeters, and the thickness is almost 1.5 to 2 centimeters. So coming to the weight, it is almost approximately around 100 grams. The presenting parts are, it has a head, a neck, the body, and a tail. So these are the four parts of this gland. So this is the head of the pancreas. Here there will be narrowing, that is called as the neck. Then we have a large body, long part of it is the body, and the terminal part where it is in contact with the spleen, that will be called as the tail of the pancreas. So these are the four presenting part: head, neck, body, and the tail. To begin with, the head. Head is said to be the thickest as well as the broadest part of the pancreas, as you can see in this picture. So here you can see this is the broadest part, as well as it is also said to be the thickest part, and it lies in the concavity of the duodenum. If you can see here, it is in relation to the concavity of the duodenum. So this is the duodenum here. So this is the first part of duodenum, this is the second part of duodenum, this is the third part, as well as this is the fourth part. If you see this first, second, and third part, it is in relation to the concavity of the duodenum. So it is within this C-shaped duodenum. Okay, so it is within the concavity of the duodenum. So head is in relation to the three parts of the duodenum. It has three borders: superior, inferior, as well as the right lateral. If you can see here, so here this is the head. So it has a superior border above, just behind this first part of duodenum. Here this is the inferior border, as well as this is the right lateral border. These are the three borders of the head, and it has two surfaces: anterior surface as well as the posterior surface. So here you can see this is the head. So it has a superior border, inferior border, as well as right lateral border, and two surfaces: anterior surface and the posterior surface. And it is extended beyond its head. This is called as the uncinate process. Uncinate process. If you can see here, they mentioned this as the uncinate process. So this is the head, and a small extension from the head. This is called as the uncinate process of the pancreas. Coming to the relations, anteriorly, as you have already seen, okay, especially the head part is in relation to this cavity here. This is called as the lesser sac, and in front of that will be the stomach itself, which will be in contact with the head of the pancreas, as well as the root of the transverse mesocolon. So this is the transverse colon, and this is the transverse mesocolon, the peritoneal fold which is covering the colon, the transverse part of the colon. Okay, so this is called as transverse mesocolon, and this root of this transverse mesocolon is attached to the head as well as the body of the pancreas. So the root of this transverse mesocolon, if you want to trace, it will be on the head as well as the body of the pancreas. So this is a very important relation with the of the head and body. Okay, the root of the transverse mesocolon, which is in the front, as well as the cavity of the lesser sac, as well as especially the stomach part. Okay, behind posteriorly, it has a very important relation, that is if you can see here, this is the inferior vena cava. This is the inferior vena cava, which is a very important relation with the head part. If you see the uncinate process, which is nothing but the extended part of the head, So in anterior relation to the uncinate process will be the superior mesenteric vessel, especially the superior mesenteric artery here, as well as the superior mesenteric vein. Superior mesenteric artery is a branch from the aorta. So this is superior mesenteric artery, and the superior mesenteric vein will be joining with that of the splenic vein to form the portal vein. A very important relation. Okay, so the uncinate process anteriorly it is in contact with the superior mesenteric vessel, superior mesenteric artery, as well as the vein. Going to the next part, that is the neck. It is, as I said, it is slightly constricted part. Okay, so this is the picture seen from behind. So this is the head and this is the uncinate process, and between the head and the body there is a part which is slightly constricted part, that is called as the neck of the pancreas, which is connecting the head as well as the body, and it is almost 2 centimeter width, very small part, and it presents in front of the formation of the portal vein. A very important relation, which is the posterior relation of the neck, is the formation of the portal vein. Portal vein is formed by the superior mesenteric vein joining with the splenic vein. When the superior mesenteric vein joins with the splenic vein, that continues above as the portal vein, which will be draining into the liver. So this relation of the portal vein with the neck of the pancreas is very important, especially when in case of the portal hypertension and other conditions. So if you want to trace the portal vein, just go behind the neck of pancreas. And this neck has two surfaces, anterior surface and the posterior surface. This picture is showing you the relation of the portal vein with that of the neck. So this is the picture seen from behind. Okay, so there are two surfaces, anterior surface as well as the posterior surface. Posterior surface is related to the portal vein, and two borders, superior border as well as the inferior border. There are two borders, superior and inferior border. So the most important will be the relation of the neck is the portal vein, which is placed posterior to the neck. Okay. Going to the next part, that is the body. The body is the largest as well as the elongated part of the pancreas. A large part of the pancreas is called as the body. This whole part which is horizontally placed, that is called as the body of the pancreas. And this pancreas is almost triangular on cross section. If you take a section, this is the section taken above downwards and seen from the side. If you see, this is the pancreas, and if you see this, especially this is the body of the pancreas, where you can see it is almost triangular in shape. When you take a section like this and see from this side, if you take a section from like this about downwards and see from the side, it looks like almost triangular in section. Okay, and it has three borders, as you can see, because it is triangular in shape. It has the three borders. One is the anterior border. This is the anterior border, which is in relation to the transverse mesocolon. There, this I said is the colon, and this is the transverse mesocolon, which is attached to most of the part of the body. Okay, so here this is the anterior border. This forms the anterior border. Okay, which is for the root of the mesocolon. Then we have the superior border. This is the superior border. Here you can see here, this is the superior border, where especially the splenic artery is in relation to the superior border. So here is the superior border, and there is a slight elevation in the superior border, that is called as the tuber omentale. If you can see here also in the picture, this is shown as a slight elevation on the superior border. This is called as the tuber omentale. Then we have the third border, that is the inferior border, which is below. Here this is the inferior border. This is the inferior border. So there is a superior border, there is an anterior border as well as an inferior border, and three surfaces. The surface between the superior border and the anterior border, this is called as the anterior surface. This is the anterior surface. Here if you can see here, this is the anterior surface. Then we have the posterior surface, which is behind and it is in contact with the posterior abdominal wall. This is the posterior surface of the pancreas. Behind, if you see from behind, that will be the posterior surface. Then we have the inferior surface. Here, this part between the anterior border and the inferior border, this is the inferior surface. This is the inferior surface of the pancreas. Here, if you can see here, this green colored area is the inferior surface. So this is the blue surface, which is the anterior surface. Then we have the inferior surface, which is the green area, and behind will be the posterior surface. So there are three borders and three surfaces for the body of the pancreas. And the relations, very important relations, as you can see here, the anterior surface is in relation to the lesser sac. As I said before, it is in relation to the lesser sac, as well as the in front of the lesser sac will be the stomach. Okay, and the anterior and inferior surface are totally covered by the peritoneum. Only the anterior surface and the inferior surface. The posterior surface is in contact with the posterior abdominal wall, so there is no peritoneum in the posterior surface. Only the anterior surface as well as the inferior surface are covered by the peritoneum. Then the inferior surface is in relation with the coils of the intestine, especially the small intestine, as well as even partly the transverse colon. And as I said, the posterior surface will be directly in contact with, it will be totally adherent to the posterior abdominal wall. So these are some of the relations of the body of the pancreas. So here you can see so the structures which are in relation to the body, as well as especially the body. You can see here, this is the posterior relation. Also we can see the abdominal aorta, as well as even the kidney. Coming to the tail, it is the narrow left end of the pancreas which comes in contact with the hilum of the spleen. A very important relation of the tail of the pancreas is it is in relation to the hilum of the spleen. Especially this is very important, especially in case of conditions where they do splenectomy. And when they do splenectomy, at that time they should be very careful about the tail of the pancreas, because when they do splenectomy, they might cut a part of the tail of the pancreas. And as you know, the most of the endocrine part, that is the islets of the Langerhans, are present in the tail of the pancreas, and this might lead to a condition called as induced diabetes. Okay, so that's why the tail of the pancreas is a very important relation with the spleen, as well as even the hilum of the kidney. And all these three structures are in relation to a ligament called as lino-renal ligament. Okay, so the tail of the pancreas, which will be coming in contact with the hilum of the spleen as well as the kidney, is covered by a ligament called as lino-renal ligament. Now coming to the pancreatic duct. There are two ducts, the main pancreatic duct as well as the accessory duct. So the drainage of the pancreatic secretion is mainly by the main pancreatic duct. If you can see here, this is the main pancreatic duct. This is more prominently seen from behind. So this is the main pancreatic duct, which is opening through the major duodenal papillae. So this is also called as the duct of the Wesen. This is the main pancreatic duct, which begins at the tail of the pancreas and it goes all the way through the body, and it indents the pancreas from posterior surface. As I said, it will be more prominently seen from behind, and it indents the whole of the body of the pancreas, then descend onwards, and it opens into the second part of the duodenum through a papillae called as the major duodenal papillae. Before it opens, it will join with the bile duct and into something called as the hepato-pancreatic ampulla, or it is also called as the ampulla of Vater. So there is a dilated part where the main pancreatic duct joins with that of the bile duct to form a dilated part called as the ampulla of Vater, or it is also called as the Hepato-pancreatic ampulla, because the liver as well as the pancreatic both are draining the secretion into this ampulla, dilated part. Okay, so this is called as the ampulla of Vater, and it opens through this ampulla into the second part of the duodenum through the major duodenal, or it is also called as the greater duodenal papillae. Okay, before it opens there is a sphincter here. This is called as the sphincter of OD. Sphincter of OD. Okay, so this opening of the major duodenal papillae at the greater duodenal papillae, or the as I said, the main major duodenal papillae, or it is also called as the greater duodenal papillae. So this point where it opens, this is the junction between the foregut and the midgut. So this is the junction between the foregut and midgut. So here this is the second part of duodenum, where the foregut will end at this opening, and the midgut will begin from this point. Okay, so this is a very important landmark where the foregut and midgut will meet. Okay, so this is indicated by the opening of the major duodenal papillae. So major duodenal papillae is draining both the pancreatic juices as well as the bile from the coming from the liver. Okay, so this is about the main pancreatic duct. So before it opens, if you see the duct, it looks like what you can say as the ribs of the fish. Okay, so that's what is called as herringbone pattern. All the ducts, the smaller ducts which are opening, they are opening at right angles to this main duct. Okay, so all these smaller ducts which are draining the pancreas, they open into this main duct at right angles to each other. So they look like the bones of the fish. So that's what is called as the herringbone pattern. Apart from that, there is also a smaller duct. This is called as the accessory pancreatic duct. We'll talk about this duct when we talk about the development of this pancreas as well as the duct. Okay, so this is also called as the duct of the Santironi. So this is the minor duct, and this will be opening into the lesser duodenal papillae, or the minor duodenal papillae. So here is the minor duodenal, very small. Sometimes usually it will be closed, sometimes it might be patent in some conditions. Okay, coming to the blood supply. Blood supply of the head and neck part is mainly by two important arteries. These are called as the pancreatico-duodenal arteries, superior as well as the inferior. So the superior and inferior pancreatico-duodenal arteries, again they are divided into the anterior and posterior, or ventral and dorsal, and then they anastomose. The superior and inferior pancreatico-duodenal artery will anastomose near the head of the pancreas. Okay, so these are the arteries which are supplying the major part of the head and neck as well as even the uncinate process. These are called as the pancreatico-duodenal arteries, which are also supplying the stomach. Okay, then the major part of the body and the tail are supplied by the splenic artery, which I said is in the superior border of the pancreas. This is the splenic artery, which supplies the major part of the body as well as the tail. Among these, one of the artery coming from the splenic artery is larger and bigger. So this is called as the Arteria pancreatica magna. Arteria pancreatica magna, which will be supplying major portion of which is the largest and longest artery, which are coming from the branch from the splenic artery, and it supplies major portion of the body as well as even the pancreatic duct, and it also accompanies the pancreatic duct. Coming to the venous drainage. Venous drainage is mainly from the corresponding veins which are which are similar to that of the arteries, and they all drain into the superior mesenteric vein, or into the splenic vein. This is the splenic vein, and the inferior mesenteric vein drains into the splenic vein, and this splenic vein joins with the superior mesenteric vein to form the portal vein. And here you can see at the neck behind, you can see this is the portal vein, which is in very important relation for the neck of the pancreas. So all these corresponding veins will drain to either to the superior mesenteric vein or into the splenic vein, and finally, or sometimes even into the some of the veins drains directly into the portal vein also. But all these veins finally drain into the portal vein. That is the main venous drainage of the pancreas. Coming to the lymphatic drainage, especially the head and neck part of the pancreas will be draining into the ventral and dorsal group of pancreatic lymph nodes. The dorsal as well as the ventral group of the pancreatic duodenal lymph nodes. The body and the tail will be draining into the pancreatico-splenic lymph nodes. Finally, all this drain into the mainly into the celiac as well as the superior mesenteric group of preaortic lymph nodes. So the main supply of the main lymphatic drainage of the whole of the pancreas is into the celiac as well as the superior mesenteric group of preaortic lymph nodes. Now coming to the nerve supply is mainly by a plexus called as the celiac plexus, as well as some portion even from the superior mesenteric plexus. So this plexus we supply the sympathetic component is mainly from the T6 to T10, and it is mainly vasomotor, and the parasympathetic will be from the vagus. And this parasympathetic component will mainly help in the control of the pancreatic secretion. Coming to the development of the pancreas, a brief introduction about the development. As you know, the pancreas is developed at the junction between the foregut and the midgut. So in a primitive gut, this develops as two buds actually. Initially it will be two bud, dorsal bud as well as the ventral bud. Dorsal bud will be the posterior bud, and ventral bud will be the anterior bud. But as the gut rotates, rotation of gut, so at that time this dorsal bud becomes the left bud, and this ventral bud becomes goes toward the right side. Later this ventral bud also moves towards the dorsal bud just below the dorsal bud because of the difference in the development of the wall of the primitive gut. So here you can see and major portion of the pancreas will develop from the dorsal bud. Here is the dorsal bud which is moving towards the initially it will be in the posterior bud or dorsal bud, then it moves towards the left side, then it is joined with by the ventral bud. So major portion of the head, neck, body and the tail is developed from the dorsal bud, and this is the ventral bud which will form the lower part of the head as well as the uncinate process. Okay, so both will have their separate ducts. If you can see here, this is the duct of the dorsal bud and this is the duct of the ventral bud. As I said before, the dorsal bud will give rise to the superior part of the head, the whole of the neck, body as well as the tail. Ventral bud will be forming the uncinate process as well as the lower part of the head. So here this is the other view seen from the side. Here you can see the development of the primitive gut. So here is the stomach and here is the initial part of the small intestine. And here you can see the pancreas is developing from two buds. This is the dorsal bud and this is the ventral bud, and the ventral bud along with the gallbladder as well as the liver bud, it is growing on the right side. So it is here, it is much more well developed. This gallbladder has developed well, and this is the cystic bud, and here are the hepatic duct, and this continuing below as the bile duct, and joined by the ventral bud which is opening on the other side of the small intestine. But later, because of the difference in the development of the wall, the ventral bud also moves toward the dorsal bud, so it has come towards the opposite side just below the dorsal bud. So this is the dorsal bud now, and here is the ventral bud, which was here. Now it has shifted towards the other side. When it moves, it also brings the bile duct along with it, and it starts opening here through the major duodenal papillae. Now you can see here there are two ducts. Ventral bud has its own duct, as well as this is the duct of the dorsal bud. Okay, so this is called as the dorsal pancreatic duct. Okay, these two ducts are separate now. Later what happens, the dorsal pancreatic duct, most of the part it will be draining here, the tail, body, as well as the neck. Then it joins with the ventral bud, and it opens through this into the second part of duodenum through the major duodenal papillae, and the remaining part of this dorsal pancreatic duct becomes smaller, regresses, and now this becomes the accessory pancreatic duct. So initially it will be opening, the dorsal bud will be opening through the dorsal pancreatic duct throughout, but later this dorsal pancreatic duct will join with the ventral pancreatic duct, and it starts opening into the second part of duodenum through the major duodenal papillae. The remaining part of the dorsal pancreatic duct, which is near the head and neck, this becomes thinner, and this is now called as the accessory pancreatic duct. To give a more clear picture of what is happening, so here is the dorsal bud, through which most of the upper part of the head, neck, the body, as well as the tail is developing, and this is the dorsal pancreatic duct, and this is the ventral bud, from which the lower part of the head part as well as the ancillary process will develop, and here is the bud for the ventral bud. So these two buds are the ducts are opening separately here into the second part of duodenum. So here you can see this is the duct of the dorsal bud, and this is the duct of the ventral bud. They are separate. Now the dorsal bud joins with the ventral bud, and major portion of the secretion start draining through this ventral bud into the second part of duodenum through the major duodenal papillae, and this is the duct which is still patent, the remaining part of the dorsal bud. Now it starts regressing, and this becomes smaller and smaller, and now it is called as the accessory pancreatic duct, and this will open into the minor duodenal papillae. Now most of the secretion from the head and neck, body, and tail of the pancreas will be drained through the initial part of the dorsal bud, then it joins with the ventral bud, and it will start opening here, okay, into the major duodenal papillae. And here is the bile duct, which is joining with the main pancreatic duct, and at the ample of water, and then opens into the major duodenal papillae. Okay, so this is how the main pancreatic duct is developed, and this is the accessory pancreatic duct. Okay, so this is about the development. Now coming to the applied anatomy or clinical aspects of the developmental anatomy. Okay, so sometimes, as we have seen, that the pancreas is developed from two buds, the ventral bud and the dorsal bud. Sometimes what happens, the whole of the pancreas, like it is developed from the ventral bud and dorsal bud, during rotation it might rotate on the opposite side, and it might cover the whole of the it surrounds the whole of the pancreas, the second part of the duodenum itself throughout, and it becomes circular around the second part of the duodenum, and this is called as the annular pancreas. So this is one of the developmental anomaly, okay, where it will be surrounding whole of the second part of duodenum, and it might sometimes even start applying pressure on the second part of duodenum, and that might lead to decrease in the size of the diameter of the duodenum, and that might lead to even sometimes obstruction. Sometimes the dorsal bud and the ventral bud might remain separate, and this is called as the divided pancreas. and sometimes even there might be small pancreatic tissue remaining, developing in the stomach itself, in the duodenum, in the jejunum, in the Meckel's diverticulum, sometimes even in the gallbladder and the spleen. These are called as the accessory pancreatic tissue, which might start developing, and this might be a major reason for the uncontrolled diabetes in some of the patients. Sometimes there might be inversion of the pancreatic duct. Instead of the major duodenal papillae becoming the major duct, it might be the minor duodenal papillae or the minor duodenal duct, which might be, or the accessory pancreatic duct, which might become the major source of drainage of the pancreatic secretion. Okay. So minor papillae becomes the major opening for the drainage of the pancreas. So the main secretion of the pancreas might open through the accessory pancreatic duct. That might become the major portion of the pancreatic duct. So this is called as the inversion of the pancreatic duct. The infection of the pancreas is called as the acute pancreatitis. This is a very important condition where there will be undiagnosed severe abdominal pain, which might be because of the infection of the pancreatitis. Pancreas, this is called as pancreatitis. This can be acute as well as the chronic. Sometimes the lesser sac, because of the acute pancreatitis, there might be the lesser sac might be developed into a cyst like thing, that is called as the pancreatic cyst, or it is also called as the pseudocyst. The pancreas is also very notorious for the development of the carcinoma, especially the head of the pancreas, which might lead to obstruction of the bile duct, and this might lead to non-drainage of the bile juice, and that lead to jaundice, and sometimes even because the neck of the pancreas is in relation to the portal vein, it might even have some pressure on the portal vein, and that might lead to portal hypertension. That might be a reason for the portal hypertension, which might lead to ascites, as well as even it might apply pressure because the head of the pancreas is around the duodenum as well as the pylorus of the stomach, so it might even lead to pyloric obstruction. And as you know, the tail of the pancreas, especially, there are the islets of the Langerhans, abnormality of which might lead to diabetes mellitus. Even if there is obstruction to the pancreatic juice drainage as well as the bile drainage, that might lead to digestive disturbances. So these are some of the clinical aspects related to the pancreas, as well as even the developmental anomalies. If you have any questions, you can definitely write to me and I will try to answer. So these are my references. Most of the pictures taken here are from the student's Grace Anatomy, but there are also some pictures which are taken directly from the internet, and I thank all those authors for their pictures and all the content which is there within their books and as well as in the websites. Thank you very much.